everyone. I hope you and your loved ones are well. I know we've all been hit really hard by this coronavirus, and if you're like me, you've been thinking about it a lot. And one thing I've been working on is this simulation of a small city and trying to learn about how this spreads, but also learn about how the interventions we're doing in our cities, like quarantines and lockdowns, are helping to stop the spread of the virus. So I'm going to randomly add an infected person into our population, and you can see this sort of halo of red that's appeared around our person and the spaces that they're traveling to and from. This virus has been calibrated to be very similar to how we understand coronavirus, and that is a 7-day incubation period on average and an infectious time of 1 to 2 weeks. We've already seen 17 people infected, and even though we see it in the simulation, you wouldn't see this if you were the government of the city or its citizens. The orange color of those people right now means that they're incubating the virus, so they're not infectious yet. So that one person in this case is a super spreader. At this point in your simulation, you start to see our hospital capacity at its limit and occasionally being overrun. So if you were the governor of the city right now, you'd probably be alerted to the fact that this virus exists and is starting to spread rapidly. I'm going to enact a mandatory quarantine. So as soon as you see that, the trips in the city are drastically reduced. And the trips you do see should be just essential trips for supplies or maybe essential jobs and emergency trips and things like that. Right away, you see the spike in infectious cases plateau. So the total number of people infected is plateaued and starting to slightly decrease. You might call this a successful intervention where you have your number of cases now in decline. Let's say after nearly a month of our simulation, now your city's economy is really feeling the hurt. You're getting a lot of pressure to lift the quarantine and things are better, so maybe you feel like you can do that. So I can actually simulate lifting the quarantine and putting things back to business as usual. Unfortunately, when I did that, according to this model, there were still infected people in the population that we hadn't identified, and you're seeing an outbreak again. So now people are starting to get infected again. And if you were in the city, you might feel the need to enact another quarantine. But you're already at a dangerous level where a good percent of the population has died. The majority of the population has been infected. You might be looking back retrospectively, how could you have dealt with this differently? Fortunately, this is a mistake we made in a simulation and not real life, so we can try again. Anyway, this is work in progress. It's an open source coding project. Follow the link in the description if you want to download it and try it out for yourself. I'm really happy you could join me. Thank you so much.